Your Artist Insurance Health Resource Center is so comprehensive. So, Jim, we're so glad to have you here. Take it away.
Actually, what I want to say is what he said.
Oh.
So it was very comprehensive, I thought. The first thing I wanted to say was I'm a person in career transition. I started out as an actor in spaghetti westerns in Sardinia for an Italian-American company in my early 20s. And then I taught at NYU in the School of the Arts, Tisch School of the Arts for 13 years. I went from that into disaster relief work for the American Red Cross, mostly earthquake work in Italy and other parts of the world. And then, by some miracle, found myself at Aetna Health Plans, where I became a contract negotiator. I worked for Aetna for about 5 years. I worked for Empire Blue Cross and negotiated contracts with the hospitals. And then I became a regulator for managed care for the state of New Jersey for the Department of Banking and Insurance, and then somehow found my way full circle, I think, back to the Actors Fund of America, where I'm the manager of the Artist Health Insurance Resource Center. This is, it's two things really. It's an 800 number, and I'm at the other end of that number, either myself or 3 research assistants who are getting their master's degrees in public administration. And we answer all sorts of questions that anybody has from around the country in any of the arts on health insurance. And it's a website. And the website, there's a listing on the sheet that's been handed out there. It's www.actorsfund.org/AHER, so it's the Actors Fund website. We have literally thousands of resources for people around the country. We do every state, okay? And what we look for mainly are group policies, so people don't have to go into the individual healthcare policy market. And we investigate them in California, New York especially, Florida. That's where most of our phone calls come from, Massachusetts. So what I want to do here quickly is just to go over some of your options in New York. Now, as I said, I was a contract negotiator for 2 large insurance companies, and the only thing I'm interested in is money and the cost, at least as it regards all this stuff. So I'm going to tell you the actual prices of these things, so it's very, very clear as we go through them. Your options: individual health insurance. You can find out immediately by going on to the Department of Insurance website for New York State what the premiums are for every HMO and point of service plans, you know what those are now, that are permitted to do business in New York State. And you can download it. It's 2 pages. It looks like this, okay? So you don't have to call them up. You find out. And just to give you an idea, and this will give you an indication why people say healthcare is unaffordable. The 2 places I worked for, Empire Blue Cross, to get their HMO plan is $321.57 a month. Okay, it's an individual policy. If you're a family, you're going to pay them $964.74 a month. Okay. Aetna US Healthcare, their HMO is $282.90 a month. For a family, it's $841 a month. That's for the HMO. That's for the most restricted network. The point of service plan goes up radically. It goes up over $100 a month. Okay, and on the individual side, it goes up over $300 a month on the family side. So you want to stay away from the individual market if you can. If you're in New York State, you're a little better off, because in New York State, these laws that apply to group policies, that is, the portability laws, also apply to individual policies. In most other states,